There are 4 key plays in the game of removing a tattoo. Number 1, the type of machine you're getting treated with and what wavelengths that machine has. This is one of the very common things people are very aware of when it comes to removing a tattoo. Number 2, the characteristics of the tattoo that you're getting removed. Again, this is a very common one that people are aware of and ask about, but there's many layers to this. Number 3, and this one is not a very common one that people take into consideration, is the health of the client and how well their body can process the ink once it's been broken down by the laser. And then number 4 is the experience of the laser operator. Sure, these all sound super obvious now that I've said them, but we're going to dive into these and explain a little bit further what we mean by these. So let's unpack number 1, the type of machine that you're getting treated with and or the wavelengths that that machine has. So everyone always wants to know whether you're operating a pico laser or a Q-switch laser. In reality, people only ever ask if you're operating a pico laser. Why? There is some sort of buzz around the word pico when it comes to getting a tattoo removed. Everyone seems to think that pico is this superior type of machine. Look, yes, it's the newest, technology when it comes to a laser machine for tattoo removal. Is it the best? I don't know. For some tattoos, probably, but for others, maybe not. I could be wrong, but I assume that most people asking if we operate a pico laser don't even really know what a pico laser is. Fun fact, we have a pico laser. I'll show you it right now. This here is called a pico second laser pen. We bought this off the Bunnings Warehouse Marketplace website for $150. But this is by name a pico laser. You literally plug this thing into the wall with a USB power cable, and apparently it's a pico laser. So this particular company is 100% playing on the buzzword of pico to sell their product. Do I think that pico pen will remove someone's tattoo? No. It may, but I doubt it. Okay, moving on. So let's break down what the difference is between a pico laser and a Q-switch laser. Actually, no, first, let's talk about their names. So a pico laser is called a pico, referring to, the duration of each shot. So of each burst of light, it's measured in picoseconds, which is 1 trillionth of a second. Whereas Q-switch is referring to a component within the laser machine itself that produces the light that comes out of the handpiece of a Q-switch laser. So the lasers aren't even named in a similar way. So they're both named referring to something completely different on the machine. In reality, it should be called a pico laser and a nano laser, because Q-switch lasers, bursts of light, are measured in nanoseconds, which is billionths of a second. So that would be more accurate, I suppose, and would make more sense. Pico laser, nano laser, or Q-switch and diode, because I believe that's what produces the light out of a pico laser. So in explaining that, I've described, one of the things that's different between a pico and a Q-switch laser: the duration of the burst of the light going into your skin to break down the tattoo ink. Another difference is basically just the parts within the actual machine themselves. The light is produced in a different kind of way. Pico has like a diode, like I was saying before, that switches light on and off, whereas Q-switch has, yep, you guessed it, a Q-switch. So it's just different technology within the machine themselves. When it comes to wavelengths that these machines produce, this is where it gets a little bit confusing. So bigger known brands, I suppose, of pico lasers, the machine itself, not the big arm that comes off it, the machine itself produces one particular wavelength, which is normally 755 nanometers. That goes from the machine up through its arm, and then at the handpiece, it's converted to 1064 nanometers or 532 nanometers, which are the types of wavelengths that a Q-switch machine produces from the machine itself. So Pico produces one wavelength, which can be used, but then also can be converted at the handpiece into two other wavelengths. Whereas Q-switch, the machine itself produces the two different wavelengths. It's split within the machine itself and then comes out to the handpiece. Sure, you can get hand pieces that you can attach to a Q-switch machine, which change it to other wavelengths to then target different colors. But the actual machines themselves produce different wavelengths. Let's go to another level of confusion. So there are many Q-switch machines out there that you can buy that are actually capable of producing bursts of light that are measured in picoseconds. So in reality, there are Q-switch machines out there that are technically both. They're both a Q-switch because the technology in the laser machine themselves is Q-switch. But on the machine, you can split the bursts of light into shorter bursts to make it a pico machine. So in reality, even though someone's marketing their machine as a pico laser, look, sure, technically it is a pico laser because that burst of light is measured in picoseconds, but it would be using Q-switch technology. So that laser technically is a Q-switch, but the burst of light coming out of the handpiece is pico. That's something that most people don't know, especially clients. They would not know that at all. All they would be asking is, do you operate a pico laser? And the operator would be saying, yes, we do, because they do. But in reality, it's Q-switch. I'm really sorry if I lost you guys throughout this video, but it is not clean cut black and white when it comes to pico lasers and Q-switch lasers. There's a whole heap of stuff going on with the technologies nowadays. So simply asking the question of whether someone is operating a pico or a Q-switch kind of isn't really like a relevant question anymore. Sure, there are some particular colors that benefit from being treated with a traditional style pico laser that produces 755 nanometers, but both machines are beneficial for particular colors of ink or particular types of tattoos. So there's no one machine is better than the other. They both have strengths and weaknesses. Okay, so number two is the characteristics of the tattoo itself. This is something that people are very aware of that contributes to the removal process, but there's only a select few that people are, I guess, hyper fixated on. So let's just break it down and explain as many that come to mind right now for you guys. One thing that people always seem to mention about their tattoos is the age of it. On paper, yeah, if the tattoo is older, it should respond better. Like it should break down quicker because that tattoo's been in your skin for more time, so your body's had longer to naturally break it down. But as I said, on paper, that's how it should be. But look, it all depends on how the tattoo was tattooed into your skin in the first place. It could be a 30-year-old tattoo, but the tattooist could have absolutely packed it in, hammered it into your skin. There could be scar tissue in there that you're dealing with. And you know, that will sort of prolong the process. Flip side, it could be a brand new tattoo, well, 12 weeks old anyway, and it could just be poorly tattooed into your skin, could be super shallow, that ink is just not dense enough in your skin and it'll break down super quick. So I don't think necessarily you can heavily weigh the expectancy of results on how old the tattoo is. Another one is where the tattoo is located on your body. So if it's closer to your heart, you have better circulation. That means your body's ability to, I guess, heal the broken down ink away from the area is better. The color of ink is obviously a big one as well. Black tattoos are the most straightforward, I guess you could say, of tattoos to remove. But it's when you start getting treatments on colored tattoos that things become a little bit more unpredictable. There are certain colors that need treatments with particular wavelengths. So that's one factor, I suppose, when it comes to colors, but also to what ingredients were used in those inks to get that particular pigment of ink. And how are those ingredients going to respond to laser treatment? There are some ingredients in inks out there that when lasered, they actually darken. So rather than lightening, obviously, they do something that's called paradoxical darkening. A lot of people call this oxidization, but it's actually the opposite of oxidization. It is taking the oxygen out of that ingredient in the tattoo ink. And in this process, it turns it to a dark gray color. Once it's that dark gray color, it can be quite difficult to remove. So I suppose in us addressing the color of your tattoo has also gone into ingredients used in the tattoo. Is there scarring in the tattoo? So I would say 75% of tattoos that we see has scarring within the tattoo itself from getting the tattoo in the first place. I'm not exactly sure how this scarring occurs in a lot of the tattoos, but like I said, a lot of tattoos we sort of see have scarring throughout them, and depending on where the scar tissue sits in comparison to the ink can either prolong the process or sometimes it can speed up the process. I know that sounds crazy, but from what we've seen, it's almost like the light energy reflects off the scar tissue. Another one that people mention is where you got the tattoo, as in like what country, but I think that plays into ingredients used in the ink. Another thing, I suppose, depending on where you got it, how was it tattooed? You know, did you get it done with a machine, or did you get it done in a traditional sense with, you know, the tapping method or something like that? Or was it a stick and poke? That can affect, I guess, how the ink sits in the skin. And I suppose that leads into, is your tattoo just thick line work, or is your tattoo just grey wash, or does it have a combination of both? If you have a combination of both or multiple techniques within the one tattoo, they're all potentially going to fade at different rates because the ink has been packed into your skin at, I guess, different densities. Therefore, it requires more or less treatments to break that ink down into small enough pieces for your body to heal away. What you got to remember is no two tattoos are alike, even on the same person. We've had people come through with symmetrical tattoos, so one on each shoulder, both done at the same time, same tattooist, and they've responded completely different to each other. So although tattoos may look similar on the surface, you have no idea what's going on beneath the surface. So therefore that adds that element of unpredictability to the process. If you have someone giving you a personalized treatment expectancy simply by looking at your tattoo, I'd be questioning it. So number 3 was the general health of the client. More specifically, you could say how well their immune system functions and also how well their lymphatic system functions, because once this thing here, the laser, has done its job of breaking the ink down, it's up to the client's body to then heal that broken down ink away. If their body isn't capable or it struggles to heal away that broken down ink, then that's going to add many number of treatments to the total that it takes to completely remove their tattoo. It doesn't matter what type of machine you treat a client's tattoo with, if they have a compromised immune system. It'll break their tattoo down, but it'll take their body a long time to actually process that ink away. Does the client live a healthy lifestyle outside of the 4 walls of your clinic? Do they drink plenty of water? Do they live an active lifestyle? Do they eat right? All these things come into play when it comes to healing away ink once it's been broken down. This topic is rarely touched on by clinics when, I guess, they're giving you information about treatment expectancy and things like that. But I personally think that this is a huge factor when it comes to determining whether someone will need more or less than average number of treatments to remove their tattoo. Okay, so number 4 of the key factors that contribute to how well a tattoo is removed is the experience and knowledge of the laser operator. There has been a massive influx of, I guess, clinics offering tattoo removal. I guess that we're already an established laser clinic, but there's just been a huge influx of tattoo removal specific clinics opening up around, I guess, Brisbane or maybe Queensland. And I suppose we don't really know how much experience these laser operators have. Sure, we're governed by Queensland Radiation Health and we do have to complete at least 100 hours of practical training before being deemed competent in getting our licenses. But what type of training did they get within that 100 hours?
What sort of experience does the trainer have? Were they taught more than just physically operating the laser? Operating the laser is actually the easiest part of it all. It's everything else that comes along with it that is the challenging part. And it's the part that just takes time and exposure to certain situations to learn and I guess build your experience and knowledge about how to apply particular settings and particular processes to particular tattoos. You may hear 100 hours and think, well, that's a long time, but in reality, it is nothing when it comes to how many variables there are in this whole process. And I guess things that can, adversely happen to particular protocols you apply to a tattoo. It's kind of funny when people are asking me the question of how many treatments it'll take to remove their tattoo, they'll always sort of throw in there, with your experience, how many treatments will I need? But the funny thing is that with my experience, I know that you cannot determine, you don't have a crystal ball, how many treatments that person will need. No tattoos are alike. So you cannot even relate previous results from a similar tattoo or what you think might be an identical tattoo to a current client's tattoo, because no doubt they are completely different people. Tattoo was on at a completely different time, potentially different ink. There's all these things involved. So with my experience, I just know that it is a very unpredictable process. Sure, there are operators out there that try to convince you that they have some sort of crystal ball that they look into, or they make you feel like their treatment expectancy that they've provided to you is somehow calculated by doing like a tattoo assessment form or something like that. But these are just sales tactics. And if you're getting told by someone that they can remove your tattoo within these amount of treatment numbers just by looking at your tattoo, or they're telling you that they can do it quicker than someone else, this actually shows their inexperience of the industry and lack of understanding for how it actually works and how unpredictable it can be. So by clinics telling you that they can do this, it's either exposing their inexperience or it's just completely exposing that they're a salesman. I think I've kind of got a little bit off course here, but I guess what I'm trying to say is the experience of your laser operator is very important for, your outcome and your results. I hope this little series has been useful to you and you do think of it when you go to eventually remove one of your tattoos one day. One final piece of advice, ask questions. I'm not going to say do your research, because that's really, really hard to do, because every single site that you will look on and say that their technology is the best, they're the fastest, they're the whatever. So it's not really do your research, it's ask questions, and feel confident within what your chosen laser operator is telling you. If something feels a bit weird or it feels like a sales type of thing, trust your gut. Anyway, that's enough from me, guys. All right, take care of yourselves. See ya.